This conference gives a safe space for women to talk about their issues, particularly their health, care and well-being needs.
So many conferences would be about LGBTIQ issues or about health issues. The uniqueness of this conference is it's brought the two together.
There's always this misconception that LGBTIQ communities is homogenous, but it's really not. We're united, but also there is a great diversity inside.
It's an absolute buzz. There are so many different women from all over Australia.
The conference is so vibrant.
It's been a really welcoming community.
But also a space that encourages discussion and debate.
The women involved are open and warm in sharing experience and stories.
It's really spiritually uplifting.
There's a uniqueness and almost a festivity in the way in which we engage our humanity and our communities.
We know that LGBTIQ women have a poorer health status, largely as a consequence of stigma and discrimination.
So conferences like this enable us to come together and genuinely speak to the sections of community that have been marginalised.
A lot of our behaviours are still really affected by internalised homophobia and biphobia and transphobia and lateral violence in the community, and actually addressing those things, I think, is the big next step.
It's a place to hear astounding things, to hear stories, to hear the research, to hear from activists and from people who are working on the ground in the community.
When you come here, you feel that you're not so alone, that there are hundreds of people like you are doing the same kind of work, working for the same goal of bringing greater justice in society.
Inclusion and intersectionality are things that people are learning more about and are really hungry to understand.
This conference is a really important space for collaboration and reminding ourselves of the solidarity within the community.
I would be surprised if a conference of our community was all just, fairy dust, although we are rather fond of fairy dust.
It's a diverse group of women.
Young queer people.
Gender diverse and non-binary people.
Older lesbians.
We had a Muslim speaker.
Women of colour. There are women from different socioeconomic status. There are also women from different ethnic backgrounds.
Women from sport.
Indigenous women.
Women with disabilities.
People from the deaf community.
Women who are in sex work.
People who are users of healthcare services, people who are providers of healthcare services. We're all here together. We're all listening to each other.
Such a diversity, such a rich array of experiences and stories, and that's where we learn, when we hear each other's stories.
When women come together and make change happen together, they move mountains.